This is a Novacare Thought Leadership series brought to you by the team building Novacare Hospital Islamabad.
So, hello everyone. This is my second blog on quality. And in this one, I will focus on what we call the product dimension of quality. Quality is a multidimensional concept shaped by the lens through which it is examined. In healthcare, debates about quality are particularly complex as they must integrate perspectives of patients, professionals, institutions, and society. The systemic and scientific study of quality began in the early 20th century, influenced strongly by the Industrial Revolution and the emergence of mass production. Thinkers such as Juran, Deming, and later Dunabedian occasionally transferred principles of quality control and systems thinking from manufacturing into healthcare. Juran's famous definition, quality is fitness for use, provides a useful starting point. This definition emphasizes that the quality of a product or service is not absolute, but contextual, determined by the ability of that product or service to meet the needs and expectations of its intended users. However, for practical application in the healthcare setting, such broad definitions require further refinement. And that's why we define 4 perspectives on quality. Scholars and practitioners commonly distinguish 4 major perspectives through which quality can be conceptualized. Number 1 is the product perspective. It's the product of the service itself. The second is the perspective from the customer, or in healthcare, the perspective from the patient. The third, equally important, is the perspective of the producer. In healthcare, the caregiver, the doctor, or the nurse. And number 4 is the value perspective. Then we talk about money, quality relative to the cost and outcomes. Each of these perspectives provide a complementary but distinct framework for understanding and evaluating quality. And in this contribution, the focus will be on the product perspective. The product perspective considers quality in terms of the inherent characteristics of the service or intervention that is being delivered. Quality is judged according to the degree to which predefined features are present, reliable, and measurable. Within healthcare, this perspective emphasizes the design and delivery of clinical service as if they were products requiring standards of specification, reproducibility, and evaluation. From a systems standpoint, product quality is best understood as the continuum involving 4 interrelated stages. The first is the design. The conceptualization of the service or care plan based on the scientific evidence, clinical guidelines, and individualized patient assessment. Second stage is execution, the fidelity with which the plan is carried out in practice. The third stage is distribution, the availability and accessibility of necessary inputs, for example, consumables, medications, and technology. And finally, the fourth stage is evaluation and iteration, or aftercare. It's about continuous monitoring, identification of errors or omissions, and real-time adaptation in evolving patient needs. Let me give you an example. The care plan. Let me give an example as the care plan. To illustrate, consider the creation and implementation of a care plan in a hospital setting. The first stage would be the design. The clinician, the nurse or physician, develops a plan following a comprehensive assessment of the patient's clinical condition. A well-structured, detailed care plan reduces ambiguity, supports consistent implementation, and facilitates continuity across shifts. Second is the execution. Once designed, the plan must be enacted accurately and consistently. High-quality execution minimizes omissions and ensures interventions are performed in accordance with best practice. Third, distribution. Adequate provision of consumables like bandages, catheters, syringes, and similar resources is essential. Delays in access to supplies not only undermine workflow efficiency, but can also directly compromise patient safety and outcomes. And finally, the evaluation. Ongoing evaluation is crucial. This includes both retrospective quality assurance and prospective adaptation, such as revising the care plan in response to changes in the patient's clinical trajectory. In this sense, evaluation functions as the healthcare analog of after-sales service in manufacturing. The product perspective underscores the necessity for robust systems that support each stage of the cycle. The hospital must therefore, number one, invest in design capacity, drawing on clinical expertise, evidence-based guidelines, and decision support tools. Secondly, support high-fidelity execution through staff training, workload management, and process standardization. Thirdly, ensure resilient supply chains, enabling frontline staff to have access to necessary materials at the point of care. And finally, institutionalize evaluation and feedback loops using audits, morbidity and mortality reviews, and quality improvement cycles to identify opportunities for improvement. Given the scale of our tertiary care hospital, where hundreds of treatments and care plans are simultaneously in operation, the product perspective highlights the importance of coordination, standardization, and continuous learning. At Novacare, we apply the principle that process is king. Process improvement is one of our strong habits. At Novacare, this approach forms one of the foundational pillars of our quality philosophy. The design of care pathways benefits from both the expertise of local clinicians and nurses and from international partnerships such as ours with Imperial College Healthcare Trust in London, which provide access to cutting-edge knowledge and quality improvement practices. As a conclusion, I would like to say that the product perspective offers a systematic framework for conceptualizing and evaluating quality in healthcare. By focusing on design, execution, distribution, and evaluation, it translates abstract notions of fitness for use into tangible, measurable dimensions of clinical service delivery. Yet, this is only one dimension of quality. Equally critical are the perspectives of patients, caregivers, and value, each providing additional insights into healthcare quality should be defined, delivered, and assessed. So my next contribution will hence be on the patient perspective. For now, thank you very much.